Hoang. I'm 24 years old and I'm from Fremont, California. Last December, I was diagnosed with germinoma, a germ cell tumor, but it took about 2 years of seeing doctors and getting prescribed wrong medications before they were finally able to give me the correct diagnosis. I was often in and out of different doctor's offices, trying to figure out why I was having certain symptoms. Some days were worse than others, and I would find myself in the ER because of the pain or the headaches would be unbearable. I felt fatigue and drowsiness, and I would often be excessively thirsty. The worst thing was that my vision was getting blurry. I got my vision checked by the optometrist, but they said that my vision hadn't changed since my last visit. I didn't take their word because on an everyday basis, books and street signs were really hard for me to read. So this was around the time when I was applying to nursing school. I would get frequent headaches from looking at the blurry words on the computer screens because the words would just block together, making it difficult to read. Fortunately, I was able to turn my applications in on time, but little did I know that it was actually the least of my worries at this point. My doctor referred me to a gynecologist, who then sent me to get an MRI done, stating that there would be a rare off chance that there was something blocking the signal from my brain. Lo and behold, a mass was found on my pituitary gland. I was referred to a neurologist who prescribed me a medication that was supposed to eliminate the tumor with ease. Instead, the medication came with lots of side effects. I felt like I was drugged for the entire 2 weeks I was on the medication. I was dizzy, fatigued, and had double vision. I even went to the ER thinking I had bleeding in the brain from the medication, but the CT scan confirmed that I didn't. My neurologist called and apologized for the side effects, but advised me to continue taking it. I continued to take the medication for another week before she called me back and told me to come into her office immediately. When I got there, she explained how she brought my case up at a neuro conference over the weekend, and that one of her colleagues would be able to do my biopsy. I had my biopsy done in October and was officially diagnosed in December. I also found out that I was accepted into nursing school around the same time. Here I was thinking about how all of my friends were either going to grad school or now working in their full-time careers. I wanted to be like them. It was unfortunate how I had to put my life on hold for something that I didn't have control of. I didn't want the fact that I had cancer stop me from being just like them. I even asked my doctors if I could do chemo and radiation while in the accelerated nursing program. Some said that it was possible, and others told me that they wouldn't recommend it. But being as stubborn as I am, I thought I was ready to do it. But for a couple weeks before the program started, my doctor talked to me about how stress could be dangerous during treatment. This is when I realized that I had to take care of my health first. I deferred school and started chemo treatment early March. I would have started earlier, but the first oncologist I had was unresponsive and unapproachable. He didn't respond to any of my emails or calls. Eventually, I made an appointment to see him, and that's when he told me that he was transferring me to another department with another doctor. This was one of the more difficult times during my treatment. I lost sight of my peripherals and essentially only had tunnel vision. But when I tried to have my PCP, my ophthalmologist, and my neurologist contact him, he never contacted any of them back. I was actually relieved when I got transferred somewhere else because I don't know if I would have been comfortable with an unresponsive doctor. And just a message to you guys out there who have just recently been diagnosed, please make sure to be diligent. Use a calendar to help you stay organized and always follow up with your doctors. Providers, please be responsive. I know you're all busy, but a quick message just letting us know you got our message often helps. I officially started treatment in March at the Pediatric Oncology Department at UCSF. I had great doctors and wonderful nurses there. I looked up to many of my nurses, not only because they were the ones taking care of me during chemo, but also because they were the ones who showed me what kind of nurse I wanted to be. Being in the hospital helped confirm why I wanted to go into nursing in the first place. No one wants to be in the hospital, but if you are, you want nothing less to be loved and cared for. Treatment went by a lot quicker than I thought. Honestly, some days were harder than others. It is a good feeling to say that I have done my treatments. I thought about how I said cancer was just a pause on life, but now that I look back on this whole season of my life, it was definitely not a pause. Cancer taught me how to be patient, hopeful, empathetic, and resilient. All of these qualities are qualities that I hope to have as a nurse. I will be attending school this upcoming November, and I know that the impact that cancer had on my life will only make me a better and stronger nurse. Thank you.